Thank you so much for having us give this session this morning. We're going to talk about kids and fairly large surgery for them and how to get them back, or the timing when we talk about this, about when they return back to sports. Disclosure is none really relevant to this, but as you've seen in this session, most spine surgeons we are pro sports, so I think that probably enters into some of this a little bit. Scoliosis in sports, oftentimes when we get these young kids, anywhere between ages generally 7 to about 14, parents want to know if they're going to have surgery or if they're not, how does the spine curve affect their life moving forward? Some of that pregnancy, pain, sports activities, and how do we answer these questions? Does it matter if it's a non-operative thoracic curve? Does it matter if it's a more lanky 5 curve down the lower of the spine? Does it matter if they had a more selective fusion, a larger fusion for cheaper body tethering? How does this enter into when we talk about this? And so these are questions that we get asked daily, and we're trying to look back at what's been written, different surveys, and try to piece this together about what to tell our patients, just as with the golfer's spine and with the other topics we've heard this morning so far. So we'll go through the benefits of sports quickly, sports and scoliosis, when do these kids get back, and then some take-home points. This is something that's also becoming very common about what we talked about. Dr. Skaggs was on a podcast a couple months ago talking about a college football player who had scoliosis in high school, had a fusion, and then went back to playing football. And so these are topics that we didn't necessarily even think about 10 years ago, letting some college football go back to sports after these large operations. So benefits of sports, we know that team sports are good. Decreased odds of smoking, tobacco use, alcohol, drug use, depression, anxiety, all things that we had looked about in our patients and over what's been published. The majority of studies reported improved health in these youth athletes worldwide. So again, these are why kids do sports, and these are why we're trying to get them back into playing sports after their scoliosis fusion. More specifically, the benefits of sports in athletes with scoliosis. Patients who have scoliosis have higher rates of body image issues, mental health disorders, with all these things of scoliosis alone. However, if they do play sports, these actually get better over time. So not only do the sports help kids who don't have scoliosis, but actually helps the kids with scoliosis improve what they think of themselves also as well. Sports and scoliosis, the estimated prevalence of scoliosis in these kids playing sports is about 27%. That's tenfold more than the average people, so much more in these athletes, higher in female athletes. And also, as we see, there's different trends, I think, akin to what Corey was just talking about with golfers and then repetitive motion. Certain sports show more curves in these kids. So ballet dancers, rhythmic gymnasts, other ones where there's bending, twisting, specific examples seemingly have more scoliosis than everybody else. When we look at the average recreational sports player average activity, it actually shows that the more sports you do actually improves your chance of not having curves. So outside of sports such as dance, rhythmic gymnastics, were these risk factors? Interestingly, less physical activity is shown to be a risk factor for scoliosis. So we want our kids to be active, we want them to do sports, and we want them to get back to it. Postural habits, so we see a lot of kids these days bending over on their cell phones, on their tablets. Doesn't seem to actually be a risk for curved spine as we get older. Scoliosis in sports, how do these patients do when they are playing sports? If they have larger curves, they actually decrease frequency and quality of those sports themselves. So the smaller curves seem to be doing just fine, but as you start getting into the curves where we're talking about doing fusions on them, they actually do worse in their sporting, in their sports themselves compared to patients who have smaller curves. Sports activities actually can actually protect against the scoliosis getting worse when we look at this. So this is a study that looked at very young kids prior to their growth spurt, kids that would need braces otherwise, and the kids who did more sports actually needed bracing less, and the curves actually slowed down. So if you flip it around the other way, sports may actually be helping this as well. Except for in the high-level sports activities, again, there seems to be a range between recreational, competitive sports where scoliosis is okay, and that those sports may actually protect, but then high-level sports where it may make those spinal curves worse. So getting down to this return to play after scoliosis operations, go back to the beginning here in the 1990s, about 35 years ago. In German, we'll translate it for you, but basically they say that you should restrict sports play in curves greater than 21 degrees. When they look at this, also more relevant to what we're talking about today, if the kids had the surgery, they say sports activity should start 1 year after their surgery, and then competitive sports should not be done at all. Now, again, this is 35 years ago. This is where we started. This is more hooks, longer rods, Harrington rods. So things have changed since then, and we'll go through briefly the next 20 or 5 years about what has changed since then. A survey is in the 2020. Again, there's not much data with this, and if there are, it's all these small studies that are put together. So we asked our colleagues, leaders in the field, what do you do? And that was what this survey was in about 2013. They held running by 3 months, sports by 6 months, collision sports by 12 months, and approximately 20% of those they did not let go back to those high sports such as football, hockey, things like that, where all surgeons let people go back to contact and non-contact sports. In addition, as the fusion became larger, less people were allowing people to go back to certain sports as well. Our group looked at this in 2019, about 10 years after that, sort of for the first time, and said, well, what do we have out there? Where do we start with baseline? And it's basically return to non-contact and contact sports was about 6 months, collision sports 12 months. So not different than what people thought about 5 or so years before that. So has anything changed in the last 10 years is what we're getting at here. Levels of fusion, when we look at different studies, no significant difference in level of fusion and return to the same level of sports. So whether it is a T2 to T12 or a T3 to L4, seemingly people get back to the same level of sports. Patient characteristics also didn't seem to matter in these studies. Skeletal maturity, age, levels fused, fusions ending at different levels, again, getting back to their sports. There are different classifications. Where is that curve? Upper spine, lower spine. In this study anyway, as the curve went down in the spine lower, people returned later to their school and back to their sports. This one, bigger patients had came back to their sports at a later time as well. But otherwise, everybody else didn't matter what the curve shape was, where the level of fusion was. People could get back to their sports at the same time. Lowest instrumented vertebra and lanky classifications, unlike those other smaller studies, said that it didn't matter. No correction loss, implant failure, or complications. So this is the other big point, is that returning to play after these surgeries is safe. A newer review, 2025, hot off the press from a couple months ago, more looked at who was delayed. So we know kids can get back to sports. We know that maybe the levels don't matter as far as that. But if they were operated on older, a bigger curve, longer spinal fusions, more distal fusion levels, and more importantly, psychosocial factors mattered about what length of time that it took these kids to get back to playing their sports. This is an interesting study that was published over the last couple months, and they looked more at a rapid return to play after scoliosis surgery. So we were talking about running at 6 weeks to 3 months, non-contact sports at 3 months to 6 months, contact sports after that. And now they're talking about returning to activity after 4 to 8 weeks. Mean return to sports is 2.7 months. So just as people were ramping up running, these are people going back to their sports. And at 12 months, nearly 100% had returned back to their preoperative level of play. So I think this is where we're headed. And studies like this are showing that as we're changing our postoperative protocols, as we're changing our surgeries, we can get patients back to sports much sooner than we could beforehand. VBT is something different. VBT patients return significantly faster to the sport. However, when you look at the VBT compared to fusions, same rate of kids going back to their sports and same types of sports as they were preoperatively. So putting it all together, team sports is good for children and patients with and without scoliosis. Scoliosis prevalence is increased in those playing sports and more increased in those really high-level athletes, male, female, and in certain sports, seemingly dancing, gymnastics, some of those other sports like that. Overall, though, a low-level sports or competitive sports can actually help patients with scoliosis. Return to play does appear to be safe, and we're decreasing the time from our surgeries to those patients going back to sports. And there seems to be maybe a more rapid return to play over a few months instead of getting into that 6 months to 9 month range. So again, thank you very much.
Great. I guess what I would ask you, you showed us data, right? A published paper that says fusion levels don't matter. I think most of us that treat the patients would argue against that, right? In our anecdotal experience. How willing are you to both push selective fusions or non-operative care? Like, how long will you let them go non-op, let a lumbar curve get to 50, get to 55 before you say, time to pull the plug?
Yeah, I think part of it goes back to what Scott was saying beforehand too. Is what is that patient going to do afterwards? Are they trying to get through high school? So you delay their fusion from their junior year till they graduate. You get it done before college and they move on, or are they going to play sports in college as well? And then maybe you fix them earlier to try to get them back to something. So I think it's all dependent on patient goals and also family goals.
Very contextual. Great. Thank you.
Thank you.